This is our presentation on the Community Health Needs Assessment conducted by AdventHealth. This presentation was created by Devin Brody, Mills Hensley, and Lindsay Stubbs. We chose to examine the assessment for AdventHealth in Central Texas. And before we start, I want to note that any sources used for this analysis and any links mentioned in the presentation will be provided in the description of the video. First, I'm going to give a brief overview of the hospitals that are included in this assessment, and then I'll move into an analysis of the CHNA itself. This CHNA was developed jointly by AdventHealth Central Texas and AdventHealth Rawlinsbrook. AdventHealth Central Texas is located in Killeen, Texas, and AdventHealth Rawlinsbrook is located in Lampasas, Texas. Geographically, these hospitals are very close to each other. They're only about a 30-minute drive apart. This geographic proximity means that the hospitals serve very similar patient populations, which is why they chose to conduct their community health needs assessment together. Both hospitals have the same mission of extending the healing ministry of Christ through whole person care. Some of their key values include quality and service excellence, community well-being, high ethical standards, stewardship, and inclusiveness. To analyze this community health needs assessment, we used criteria developed by Pennel and colleagues in the article Nonprofit Hospitals Approach to Community Health Needs Assessment. We also used the 6-point scale developed in this article in order to evaluate each of the criteria. The first criteria we look at is the definition of community. We scored this a 5 because the community is clearly defined based on geographic boundaries. 7 zip codes and 4 counties are included in the primary service area, which is where approximately 75 to 80% of the patient population lives. A community health profile with descriptions of demographic characteristics is also provided. Next, we look at the presence of clear goals and measurable objectives. This scored a 1. While there are 3 priorities that are addressed, the specific goals are not included in the CHNA. To improve this area, an evidence-based solution should be included, and this intervention should include clear and measurable goals with specific milestones. This will help strengthen the CHNA and make it easier to develop meaningful change in the community. The next area we looked at is partner and stakeholder involvement. This area scored a 4. The hospitals developed a Community Health Needs Assessment Committee, and this committee included representatives from the hospitals, public health experts, and representatives from the community. Community representatives included representatives from low-income, minority, and other underserved populations. This area is strong because it involves multiple partners and stakeholders in the evaluation and identification of healthcare areas of need in the community. The hospitals made sure to include representatives from many backgrounds to ensure that all community viewpoints were properly represented. They also consulted many different public and community health experts from many fields. Organizational structure scored a 4. The hospitals developed a Community Health Needs Assessment Committee to guide the hospitals during the assessment. They also created a Hospital Health Needs Assessment Committee to select the identified needs that would be addressed after the assessment. This area is strong because the hospitals created these specific committees to investigate community health problems. The committees included not only members of the hospitals, but also a diverse group of community members and stakeholders. This organizational strategy allowed for the hospital to be in a position to greatly benefit from this analysis. Feasibility and sustainability scored a 2. While the CHNA considered the availability of community resources and their ability to impact the community, they did not include a specific plan for intervention within the CHNA. While this plan is included in the Community Health Plan document, there is not significant information given about where the resources for the planned interventions are coming from, nor is there information about the sustainability of these projects. To improve this area, the hospital should include information about the resources needed to implement intervention in the prioritized areas. This will help determine if the plans are feasible. They should also conduct an analysis on the long-term costs associated with any chosen intervention. This will help ensure that the solution is sustainable and will help prepare the hospital for future costs. Identification of assets or resources also scored a 2. The Community Health Needs Assessment Committee and Hospital Health Needs Assessment Committee created a community asset inventory to understand existing efforts to address issues. This inventory includes current community resources that address identified needs. While the CHNA does a good job of identifying these community resources, there are other forms of resources that should be considered. To improve this area, the hospitals should also examine resources such as financial resources, human resources, and materials resources, among others. By assessing other resources, the CHNA will more accurately reflect the capabilities of the hospitals, which will help prevent the hospitals from attempting to implement a solution that is not feasible. Description of the process received a 5. The CHNA does an excellent job of outlining the processes used. They described how the CHNAC was formed, how data was collected, how data was reviewed, how community input was used, how stakeholders were involved, and how the issues were prioritized. The high amounts of details used is the greatest strength of this area. This detail adds to the reliability of the findings because it is clear how the results were found. This also allows the process to be replicated in the future for additional needs assessments. The accessibility of the plan also received a 5. The plan is easily found on both the AdventHealth Central Texas and AdventHealth Rawlinsburg websites under the Community Outreach tab. They can also be found on the main AdventHealth website. This ease of accessibility allows community members to access the assessment and view the proposed interventions. Evaluation of the plan received a score of 2. The evaluation of the plan was not included in the CHNA document, but instead can be found in a separate document called the Community Health Plan. The CHNA states that specific goals and evaluation methods will be included in the Community Health Plan that is to be developed in the future. This indicates that at the time of publication of the CHNA, there was not a Community Health Plan in place. Therefore, at the time that the CHNA was published, it was missing a critical aspect. In the future, AdventHealth should be sure that the plan for implementation is complete when the CHNA is published. It would also be helpful to provide all of this information in a single document, as this will make it easier for stakeholders to see how the community will benefit from the interventions. Examination of data received a 4. The CHNA report uses multiple reliable sources, including health utilization data, primary surveys of community members, and secondary health data to inform their assessment. The existing health and demographic data was collected from various publicly available sources, including the CDC, State Health Department, and the U.S. Census Bureau, among others. This data includes health conditions, social determinants of health, and health behaviors. Data about hospital utilization was also used, including data about hospital usage by patients that are uninsured or underinsured. Other potential sources of data include Medicare and Medicaid, school health data, and health utilization data from other healthcare providers in the area. The strongest characteristic within this criteria is the detailed description of the data collection process and the reliability of data sources. These characteristics add transparency to the data collection methods and can build trust regarding the validity of the overall CHNA. Before moving on, I wanted to go over the scores we gave for each of the remaining criteria. While we will go into more detail about these criteria and how they're seen in AdventHealth CHNA within the next few slides, I did want to mention their scores so that we could have a broad overview of the CHNA as a whole. Identification and prioritization of issues received a 4, examination of causation of problems received a 2, consideration of local context received a 4, strategies to address issues received a 3, evidence-based strategies received a 2, and reflect social determinants of health received a 4. Overall, this brings the score for the AdventHealth Central Texas CHNA to a 53 out of 80, which is above the median found in the paper by Pennel and colleagues. So while there is definitely room for improvement in the CHNA, they are on the right track and performing better than other hospitals.
Okay, so now we'll start to take a look at the types of issues that AdventHealth found happening in the community, how they decided to prioritize these issues, and then the action plans they kind of put in place to address these issues. After conducting their community health needs assessment, AdventHealth identified about 12 issues that were really pertinent to the community, and these were mental health, drug misuse, preventative care/screenings, diabetes, food insecurity, physical health, hypertension, housing, high cholesterol, heart disease, nutrition and healthy eating, and then lastly, obesity. So after identifying these issues, they met and kind of discussed the importance of each of these by using 4 different criteria. Those were alignment, impact on community, resources available to be able to help solve the issue, and then outcome opportunities, and each of these were given a different weight based on their own individual importance. So after all of this, AdventHealth was able to show that they had 3 issues of top priority. Those were nutrition and healthy eating, mental health, and preventative care and screenings. I chose to discuss nutrition and healthy eating and preventative care and screenings as part of this presentation. We'll start and look at nutritional issues first. We'll look at the causes and implications of these issues. So first, for causation, we do see in those graphics at the bottom that Bell County, Texas, which is where Killeen, Texas is located, does have a lower median household income than both Texas and the United States. It also has a higher unemployment rate than both Texas and the United States. So these kind of economic issues do lead to that idea of food insecurity, so a lack of accessibility to affordable and nutritious food. The community health needs assessment that AdventHealth conducted also talks about how 40% of community survey respondents reported eating fruits and vegetables less than 2 days a week. So we do see that lack of nutritious eating in the community that needs to be addressed. It's also important to note that the implications of not having nutritious food easily accessible to these people is that healthy, nutritious eating helps to build up immune systems and prevent the incidence of chronic diseases. So this issue is really important to the community, as targeting it and solving it can really help the overall health of this community. We see AdventHealth's action plan. So this plan is going to occur over the course of 3 years with 3 specific tasks that are to be done in each of those years. Basically, overall, this plan is going to provide education surrounding nutrition and how to do it on a budget, as well as providing fresh produce to people that are considered in these food deserts. And they're going to do this through partnerships with community organizations. So in that year 1, we do see that their task is to create those partnerships with those community organizations. In year 2, they're really focused on marketing their classes and the resources that they're going to be giving out. And then in year 3 is when they'll actually provide these classes to adults in these food desert areas, as well as using the mobile food truck to be able to provide produce to people in these areas as well. We do see that AdventHealth didn't provide the evidence-based intervention that they used to create their plan in the action plan available to me, but I did find an evidence-based intervention that was very similar to what they're trying to do and showed significant results. So this evidence-based intervention is in relation to the SNAP Ed program. So SNAP is the Supplemental Nutrition Assistance Program that is provided to people in these low-income areas and these food deserts to kind of help provide them with affordable food. And so SNAP Ed is just the educational component of this program. So the education here really combats issues regarding health literacy and nutrition by including education on how to eat nutritious on a budget, being able to read and understand ingredient lists, and being able to understand serving sizes. This information is really necessary because it helps provide skills in food resource management. So since we're really looking at these food deserts due to food insecurity, budgets are really tight. So being able to provide these people the skills to be able to eat healthy on a budget is really going to help solve these issues. And then the results from this study do show significant results in improving food security in these areas and for these people. So my next slide discusses the consideration of the local context. So just a couple things to keep in mind with this strategy is that many of the nutritional issues of this community do occur to economic disparities. McLean, Texas is more urban than it is rural, so it's not being too far from grocery stores or not being able to access it, but it's that economic aspect. So really making sure that we're able to give these food resource management skills to help solve this issue. And then lastly, as I said, it's not a very urban area, it's more rural, so they do have about 54 schools. So it may be helpful for AdventHealth to try to look into partnerships with the public school system to be able to gain a stronger foothold in the community, just because families do center a lot of their lives around the school and extracurriculars that are happening there. And then my next slide reflects the social determinants of health with this issue and this strategy that they're going about. So it does address issues related to income. Like I said, that economic aspect of food insecurity. It's providing education, health literacy on nutritious eating and how to do so on a budget. Overall, it is targeting that issue of food insecurity, which is a social determinant of health in itself. And then lastly, it can help aid in positive outcomes for early childhood development, making sure that these children are getting those nutritious whole foods, and avoiding that stress of food insecurity really can have positive impacts on a child's development early on. We're now going to look at the causation and implications of preventative care and screening issues. Again, in that graphic below, we do see that Bell County, Texas has a higher rate of preventable hospitalizations than both Texas and the United States. And additionally, AdventHealth's CHNA states that according to community survey respondents, 21.7% are not aware of what preventative screenings are needed. Among those that are aware, 19.1% report not getting regular screenings. Public data shows that less than 25% of community seniors are up to date on necessary core preventative services. So we are seeing this kind of lack of preventative care and screening in this community. And it's important to note that the implications of this are that by avoiding this preventative care and screening, we may be looking at an increase in the cost of healthcare for people overall in this community if conditions and complications are not caught early enough or prevented, leading to more acute medical care that oftentimes is more expensive. We look at AdventHealth's action plan. Again, this is set to occur over the course of 3 years, except this one is a little different in that they're going to be completing the same task over those 3 years. So basically, they're looking at, again, creating partnerships with community organizations in order to hold community health fairs that are free and open to the public. At these health fairs, they'll be able to provide basic screenings for people that they may not get if they haven't gone into the hospital or into their primary care office, as well as providing education on the importance of preventative care and these screenings. So my next slide talks about the evidence-based intervention. Again, AdventHealth didn't list the one that they used to create their plan, but I did find one that was very similar. This one is specifically about cancer screening at community health fairs and kind of the efficacy of this and whether it helped the community or not. So basically what they did is at these health fairs, they provided screenings for a couple different types of cancer, as well as, again, providing that education on the importance of these screenings and getting preventative care. And then they kind of followed up with their participants to see if this made a difference at all. So we did see from the results of this that many of the participants were willing to speak to their provider after the health fair, either about the results that they received from those screenings that they conducted, or about talking to their provider about getting further screenings in the future to continue on that preventative care. A lot of participants also talked about how they relayed the information they learned at the health fair to other people in their life. So even the people that didn't attend the health fair were still gaining this education and this material that was given out to those who did go. So my next slide goes into the consideration of the local context. So right now in their plan, they really only have a partnership with one church for these community health fairs, but Killeen, Texas is a very religious community. So it may be important for AdventHealth to kind of look into partnerships with more places of worship, just because people already have that trust in their church or their synagogue, and being able to have partnerships with these organizations might help encourage the participation and the trust in the interventions that AdventHealth is trying to impose on the community. It's also important to remember that the community itself is split into 50% female and 50% male, so it's important to ensure that the resources and the education provided for certain cancers or screenings or conditions applies to both males and females equally to make sure that we're covering the needs of the entire community. And then my next slide talks about this reflection of social determinants of health for this specific intervention. Again, we have that educational component of the importance of screenings and preventative care. It's also addressing the issues of social inclusion and non-discrimination. Because these health fairs are public and open to anybody, we're really being able to help the entire community, as well as ensuring that the educational materials we provide are applicable to all races and ethnicities. And then lastly, screenings at health fairs with hospital staff are an example of affordable and quality health care because they are free and being done by medical professionals. Additionally, as I mentioned, this could help decrease the cost of healthcare for an individual overall if certain conditions are caught early or even prevented by avoiding that severe and acute care.
Thank you, Devin, for that in-depth review of the key criteria. Now I'm going to talk a little bit about the synthesis of these key criteria, an evaluation of the interventions, and then some recommendations on how to make those interventions better. So first we're going to start with the nutrition and healthy eating. We're going to start with the current evaluation of this nutrition. It's currently focused on finding adults in food deserts and providing nutrition classes through community centers, using primary prevention to reduce malnutrition and food insecurity. They are addressing the health disparities in the area, but they could do better in our opinion. It does not actually address the transportation issues in the community to get the food or to get to these nutrition classes. And one key statistic in this population is that 25% of older people live alone, and it might be difficult to attend these nutrition classes. So we thought that a better intervention can help with these isolated seniors in these food deserts and provide food to these people should be implemented to better fit the population. This intervention will better help serve the 25% of the isolated seniors in the population that 55.9% live in low access food areas and 29.4% live in very low food access areas. This would better help solve the problem for more measurable change. We found a new evidence-based intervention, which is an intervention that provides home-delivered meal services for older adults living independently. This actually shows evidence of the reduction of malnutrition in these communities while reducing healthcare costs and spending. And a little bit more about the intervention. Meals are delivered to seniors that are 60 years or older and provided 5 days per week. So that's what the actual intervention does. And the link for this intervention can be seen at the bottom of the screen. So some of the implications for this, we're going to first start with fitting the population. This is basically showing that this will better fit the population. Seniors have a higher risk of malnutrition, which leads to a higher chance of causing changes in cognitive function, more chronic diseases, and need of medications. This is just something new that these people actually have a higher risk. And there's many more different causes that can be caused by this malnutrition as well. This new intervention is a better prevention intervention because of the high number of isolated seniors in the community, as we saw earlier at 25%. And this better impacts seniors, which are the higher risk of malnutrition in a community with a large percentage of food insecurity. And some of the specifics of this intervention, it will drive down healthcare costs because seniors are a major part of this expense, as I was talking about earlier, with the higher chances of chronic disease and medications and others. This better addresses the higher risk individuals in the community. And this is also a prevention intervention, but is more specific for the population in need. And this helps solve the problem of food insecurity for the higher risk individuals that will not have access to the original nutrition classes, which they was in their original plan. Moving on to the preventative screenings priority. This is a little current evaluation of that. The current interventions focused on preventative screenings for a variety of issues, including cardiovascular disease. The health plan focuses on reducing obesity and heart disease with these screenings. But what we found is there's not a lot of evidence that screenings actually help with heart disease. So in the community survey, 21.7% of people were not aware of the screenings needed, and less than 25% of seniors are up to date on their screenings, which Devin talked about earlier. Preventative care should be taken and is important for this community, which they're trying to do. However, screenings and the intervention that they are using are not the best option. If the community wants to reduce heart disease and obesity risk factors in a prevention setting, they should go with something that has more evidence to do so in a primary prevention effort. This will lead to a more measurable change according to the USPSTF. So what is this intervention? It is an intervention that the USPSTF recommends that has shown evidence to reducing risk factors of cardiovascular diseases. The actual intervention is a behavioral counseling intervention that promotes a healthy diet and physical activity. And we believe that this is a better way to implement a primary prevention effort that shows more evidence for helping a community, especially this community. And the link for that intervention can be seen at the bottom of the screen. Some of the implications of this intervention and how it fits the population is current interventions are more concerned with providing free or reduced cost care to the individuals varying throughout the community. This intervention will better fit the population by using evidence-based practices to reduce the risk factors of heart disease and obesity. This will help improve health outcomes, quality of life, and reduce expenses in healthcare spending on these individuals that are driving up the cost with these cardiovascular diseases. Some of the specifics: this is a primary prevention effort for the population to reduce risk factors for heart disease. We think that this should be a high-risk approach because this will cost money providing these counseling efforts, and they should go to those that have the highest risk factors for the heart disease. And the intervention does not focus on children, which is kind of a hole in a lot of the health plans, but we do believe that other efforts should be made in this regard. So those are a couple of the interventions that we recommend to better fit their population and show more of a measurable change. Thank you for your time and have a good day.